Hello, I'm Dr. Al. Thanks very much for joining me to uh, share some information about papillary breast cancer. We'll talk about what it is, some differences between papillary cancers and other breast cancer, and then some considerations about treatment. So, papillary refers to a particular appearance under the microscope. A papillary growth is a branching structure. Uh, Sometimes it can be not unlike a small bush you might imagine in the garden with a fibrous core and the cells and branches around it. And these growths start within the ducts or transport tubes of the breast, as do ordinary breast cancers. And they can grow within the ducts to be quite large while still remaining confined, and they can have a thick fibrous capsule around them. Let's look at some pathologist descriptions. In the first one, we see the word encapsulated papillary cancer, the same in the second one, but in the third one, we see the expression invasive papillary cancer. So let's look at that distinction. When a papillary cancer is invasive, it's penetrated beyond its capsule, it's penetrated beyond the normal boundary of the duct in which it was formed. So it may have the potential to be more biologically active. So just to compare, we see that papillary cancers have a special organized pattern of growth. And we know that these are less likely to spread. And as such, they tend to behave in a fashion that is similar to the best ordinary cancers. But although they're better cancers with a better biology, they're still cancer. So it's appropriate to act when these cancers are found, to remove them completely. And then, with regard to any additional care, just as with ordinary cancers, to consider the whole patient, their general health, their preferences, and to consider the particular features of the tumor, and especially whether it's invasive or if it has other associated areas of non-invasive cancer nearby. And although no institution or clinician will have hundreds of personal cases of papillary cancer given its rarity, we have some guidance from the medical literature. And one study within the last 5 years published, which I found of interest, was a US population registry report in which approximately 10,000 cases of invasive papillary cancer were reviewed over a 20-year period. And the key finding was that those patients who had a lumpectomy and radiation treatment to follow uh, did better in terms of overall survival than those who had a lumpectomy alone. And that is indeed the standard of care for most ordinary invasive cancers. This is a reference to that paper for anyone who's interested. So to summarize, papillary cancers are uncommon, better cancers. If they're invasive, the standard of care would be a lumpectomy and radiation treatment. But individual preferences are important. And just as with the better end of the spectrum of ordinary cancers, there's a tendency to de-escalate treatment. It's a matter of looking at, are there factors which would make radiation treatment quite easy for an individual person, or are there factors that might make it more difficult? And certainly, if a person chooses to have endocrine treatment like anastrozole or tamoxifen or letrozole, then a case can be made for avoiding radiation treatment, just as it can be with the better ordinary cancers. So if there is an informed choice made and it's for no treatment, it would be important to follow closely to detect any recurrence. Well, thanks very much for your time.